Okay, so are you concerned about the rising cost of healthcare? Many of you don't know what's about to come down the line, but it's going to impact your pocket significantly when it comes to the cost of your insurance. Specifically, what we're going to be talking about is Medicare and how the Inflation Reduction Act is going to affect people like you and people, whether you're on the Part D of Medicare or you're on Medicare Advantage. Both of these are going to come with a cost increase and some cost constraints. And so why is this important? Well, the reason why it's important because it directly affects you as the consumer. So what happened was the Inflation Reduction Act got put into place. And when this got put into place, part of that bill, there was a small section in there that said that due to the rising of inflation, we are going to now alter some of the costs that are inside of Medicare. And so you're going to see tweaks and changes inside of Part D, and you're going to see some tweaks and changes inside of your Medicare Advantage plans. Well, my name is Miles. I'm a licensed insurance agent here with Apollo Health Insurance. And today what we want to do is help you understand the Inflation Reduction Act and how it's going to affect your Medicare plans. So first and foremost, the Inflation Reduction Act is built to help decrease the rising cost of inflation and what it's doing to people both with their health care and at home. Specifically, what we're going to focus on today is how it's going to impact you. Why are we coming to you with this news, and why haven't you maybe seen it out on the internet yet? Well, the funny thing is that the CMS, Center for Medicaid and Medicare Services, has decided that they're going to wait until October to give you this information. So we, as the broker, want to be putting this information out in front of you before it's too late. Imagine this. You have a complete change in all of your costs in terms of your prescriptions, how they're paid for, which ones are covered, which ones aren't, if you can be on a payment plan, or if there's going to be rising costs to your Medicare Advantage plan. Imagine it's October 1st. You've probably already made up your mind and decided which plan you're going to go with for this year. You've maybe talked to your broker, you've maybe talked to an agent, you've maybe talked to an agency or even a carrier specifically. And then all of a sudden, everything in your plan gets changed. Now, I'm not going to say it may be that drastic where everything gets changed, but there will be a lot of changes coming this way. And so we, as the brokerage, wanted to come to you with a series of videos and even a longer video to help you understand this. So first and foremost, the biggest thing that's going to happen is carriers are going to be asked to pick up a bigger or larger portion of your prescription drug costs. And so, for example, this year, the average person needs to pay in about $3,300 to $3,800 to their prescription drug plan to get any type of additional coverage from the carrier or from the state or the federal government. What's going to be changing is that is going to be reduced to $2,000. And since the carrier is taking on more responsibility, you as the consumer, now that some of that pricing is going to fall back on you, not all of it. And so what we're going to see is the average cost of a Part D plan over the past year, maybe even 2 years, has been hovering right around $30. What this is going to do is this is going to double or triple the cost of those Part D Medicare plans. And it's going to put some constraints on which drugs or prescriptions are covered under certain plans' formularies. And so more so now than ever, what you need to be doing is continuing to keep your prescription list up to date, your RX list up to date, informing an agent or broker that you work with of that. And if you don't have any of that in place, or if you are currently a client of ours here at Apollo, we would love for you to contact a licensed agent today so that way we can help you navigate the turmoil of the Inflation Reduction Act and how it's going to affect your Part D Medicare and then also any of your Medicare Advantage plans. Now, you may be asking yourself, what does this do or what does this mean for me? Well, when it comes time to enroll in your prescription drug plan for the 2025 calendar year or your Medicare Advantage plan for the calendar year, there are going to be some changes in those plans. Some of these plans are going to be costing you significantly more. We've seen prescription drug plans out there right now that are $0, 50 cents, in the low 10s, maybe even in the 20s or 30s, a lot of those plans are going to see a significant price increase. If you're not working with a licensed agent or a broker who can look at all of your options, you could be stuck or pigeonholed into a plan that isn't going to be best for you. So what does this mean for you as the consumer? Well, first and foremost, we talked about how the government isn't going to roll this out until October. So it's really important that we get this information in front of you today. So that way you can prepare yourself, because we are really only about 4 months away from the annual enrollment period. This is going to be unlike any annual enrollment period that we've ever seen, and it's going to be important now more than ever to make sure that you have a licensed agent, a servicing agent like us at Apollo, where we service you from day one all the way through your Medicare every day, every step of the year, every single annual enrollment period, every single open enrollment period, because there are going to be a lot of changes that are going to happen. The first thing that's going to happen is you're going to notice that there's going to be significant cost increases to prescription drug plans. Some plans out there right now are $0, 50 cents, $13, $25, $27, $34. A lot of those plans are going to probably go up to somewhere in the range of $60 to $90. And if you don't have a licensed agent working with you or a broker who can help assess all of your options, you may be pigeonholed or stuck into a plan that's going to cost you a lot more than what you want to pay for your prescription drug plan. Or you may be auto-enrolling or continuing to renew your Medicare Advantage plan that may come with a cost, and then actually your prescriptions won't be on that formulary. And so it's going to be really important to do two things. One, the first thing you want to do is make sure that all of your prescription drug lists are up to date. That's going to be the first step that you'll need to do to properly go into this annual enrollment period, or to properly go into a assessment of your prescription drug plan when you're looking at a Part D or a Medicare Advantage plan. The second thing that you'll want to do is make sure that you are working with a broker who can look at all of your options. If you're just going directly to a carrier or a captive agent, what's going to happen is they may have 3, 4, maybe 5 or 6 options for you. As we see, most plans right now, most carriers right now have about 3 options on their Part D, and then obviously there's a multitude of options depending upon where you live, what county, what state, what zip code, in regards to your Medicare Advantage plan. And so as a brokerage, instead of just calling 4 different carriers, 5 different carriers, getting all of your quotes through that way, spending hours on the phone, you can actually work with one agent who can look at multitude of options, or almost all the options in your area, depending upon what carriers that they're licensed with. So this is going to be really important for you. The next thing that you'll need to do is that you need to make sure that you have an up-to-date list of your prescriptions, because of this. Formularies are going to be shrinking. So the prescription drug plan that you're on today may not be the formulary and prescription drug plan that you'll be on for 2025, because they are going to be cutting some of these prescription drugs from their plan, because the carrier is now assuming a lot more cost. Now, some of that cost, like I said before, is going to go back to you, but the other way that carriers are going to help make up some of this portion is that they're going to be cutting out some of those prescription drugs that are on their formularies. So it's going to be important for you to make sure that you're ready going into this annual enrollment with everything up to date, so that way we can look for you and fight for you in regards to your prescription drug plans. The other great thing about Apollo is that we are able to find other alternatives to prescription drugs and how they're covered. Many people don't know that your doctors are able to get you a copay card that would give you a discount at local pharmacies for the 2024 or 2025 year. That's going to be a huge help. Also, people aren't really familiar with how GoodRx works in conjunction with your Medicare plan. So sometimes we can find you discounts. Insulin sometimes can be actually 1/3 of the cost if you actually were to just go through GoodRx, but you wouldn't know that if you weren't working with an agency who is able to look at all of your options and has all the information in front of them, or is creative in finding you healthcare solutions to your prescription drug plan or to your Medicare Advantage plans that you have. So again, the cap is going to be going down from $3,300 or $3,800 to $2,000, and the carrier is going to be asked to pick up a lot of that cost. And so for you, this is actually going to be a good thing in the long run. But again, you may be looking at your prescription drug plan and your supplement plan and thinking, man, I can't really pay an additional $260 or whatever your cost may be And it may be a good time to start thinking about alternatives to those plans. Maybe that's getting a higher deductible Medicare supplement plan. Maybe that's switching to a Medicare Advantage plan that has all of your doctors in network, or maybe has in and out of network copays, so that way you're not constrained to the network that the carrier has. Is going to be a good thing as well too. So part of the Inflation Reduction Act is also this, the cost of medication. If you have one prescription drug plan or one prescription that is going to be over $600, you're actually able to be put on a payment plan from that carrier. So this is a twofold plan to put in place, and the original writings of this plan were actually written in April, and then they're going to be confirmed, well, they're supposed to be confirmed by May 4th, but we know how things work when you're working with the federal government, as they tend to be delayed. And so we haven't seen anything out on this right now, but there is going to be payment plans for those of you who can actually break up the cost of your prescription drug throughout the year, so that way you can make it more affordable and pay that over time or monthly. So what are we doing right now? Well, what we're doing is we're providing you with the information and the knowledge that you need to make an informed decision come this fall, because this is going to be unlike any annual enrollment period that we've ever seen. And so for you as the consumer, it's very important for you to get in touch with a licensed agent, so that way you can make an informed decision and you can start preparing yourself for the wins and the turmoil ahead for this prescription drug plan. Again, we do think this is going to be a good thing in the long run, but it's definitely going to change how you look at your Medicare, or how you receive your care, or how you get your prescription drugs, or how you go about finding the right plan for you from 2025 and moving forward. Again, I can't stress this enough. Of all of the years that you've been on Medicare, this is the one single most important year. 2024, October through December, going into your plan year of 2025, is going to be the most important time for you to work with an agent who is able to look at every single option that's in front of you based on the prescriptions that you're taking and the care that you need, to make sure that you are in the best plan available for you in 2025. Currently, there is no open enrollment period for a Part D prescription drug plan. So if you're seeing this information now, it helps you prep for the time ahead. Because what's going to happen for many of us is maybe this information didn't get to us in time. Maybe we're just now hearing about it from the federal government and it's October 1st. And now it's really too late to look into or try out a prescription drug plan. And so hopefully, we're hoping, fingers crossed, that the federal government allows the open enrollment period for a Part D prescription drug plan to come back. That way, it gives you, the consumer, more protection, because you may get into a plan, you go to fill your prescriptions in January, and you realize the plan that you're in is not the plan that's going to be best suited for you based on some prescription drug plan changes, or maybe you go to the doctor to start the year in January, and that's your one-time annual checkup, and they find something, they need to put you on a new prescription drug that's not on the current formulary, and then you've got to make some switches. And that is just going to be consumer protection for you going into the 2025 year. So again, just to recap what we've hit on, the Inflation Reduction Act that was put into place by the current administration is going to have drastic changes to Medicare. This is going to increase Part D premium costs from an average of about $30 to $60 or $90. There's going to be cost constraints and costs coming with prescription drug, or with Medicare Advantage plans that have prescription drug plans attached to them. And then also, it's going to be a changing of formularies from pretty much October through December. So the plan that you get on October 15th, your prescription drug plan or Medicare Advantage plan, may not be the same plan that you signed up for come January 1. I know that's not necessarily what you want to hear, but it's just the information that we've been presented with. We didn't want to wait till October 1st to give this to you. We wanted to give this to you now, so that way you can better prepare. Again, get a list of prescription drugs that you're currently taking or are on. Make sure that you contact your healthcare provider, whether that's your doctor, your specialist, your endocrinologist, whatever it is, to make sure that you're on the best prescriptions for you heading into the 2025 calendar year. And then also make sure that if you aren't working with a broker, so I'm talking if you're working with a captive agent or you're working with a carrier directly, I do not think that they might have the best options for you or the best available options for you. And so it would be a good idea just to check, to listen and work with a licensed broker here at Apollo Health Insurance today. We look forward to hearing from you, and thank you so much for tuning in.